For full details, including terms and conditions, visit unlock.com/legal. Call 1-888-780-6854 to speak with a representative today. Actor portrayal. Terms and conditions apply.
Lisa, thanks for having me over. Your new kitchen is gorgeous. How'd you find the money to do it?
We worked with this great company, Unlock. They help you unlock the future value of your home to get the cash you need today.
So it's a home equity loan?
No, it's not a loan at all. There's no monthly payments and no interest charges ever. And you can use the money however you want. We were able to redo our kitchen and pay off our credit card debt.
Wow, Jack and I could really use this to finally pay off our old student loan debt. How do I get started?
It's easy. Just give him a call or go to unlock.com.
Call 1-888-780-6854 to unlock the value in your home and get up to $500,000 in cash with no monthly payments and no interest ever. Use the money for home improvements, to pay off debt, or to add to your retirement fund. It's up to you. Visit unlock.com. That's unlock.com. Or call 1-888-780-6854 now to get started.
So, hi everyone. Welcome to another episode of Unpacking Possibility. I'm your host, Tracy Stein, as always. I'm so happy to be here with you. I am so excited about our guest today. She's amazing on multiple fronts, and in a moment you'll hear why. But my guest today is Dr. Carol Ginandes. I'm going to tell you a little bit about her at first, and then she'll tell you more about herself and her work and what's so remarkable about the larger topic we're going to talk about today, which is hypnosis for not only mind healing, but body healing. So Dr. Carol Ginandes is a health psychologist who practices in the greater Boston area. In her clinical practice, she integrates hypnosis and mindfulness with psychotherapy to help clients address a range of mind-body issues. Carol holds a faculty appointment at Harvard Medical School, and she offers supervision and training for professionals. In her cutting-edge research, Carol has explored the area of hypnotically accelerating bodily healing. And you heard that right. So using the mind to heal the body. I can't wait for us to talk more about that. But there's more, because in addition to Carol's award-winning professional publications, she's created several mind-body hypnosis audio programs for a variety of conditions available to the general public. These include topics like preparing for surgery, moderating or alleviating allergic reactivity, normalizing blood pressure, practicing deeply restorative napping. And I bet you didn't even know that was a thing, but now that you do, I bet everybody's going to run home to do that because it sounds amazing. And reducing the discomforts of TMJ, otherwise known as temporomandibular joint disorder. If you have it, you know exactly what I'm talking about. And tinnitus. And Carol's audio programs are available via Hay House, just like mine are. And so I feel like I know you, Carol, even though we haven't met in person, but we spoke many years ago. In addition to Carol's work as a psychologist, you should know that she's also a fine art photographer and a former yoga instructor. Now, Carol, when I looked on various websites to familiarize myself with your work, I realized that you received a fellowship to Yale Summer School of Art, where you were introduced to documentary and portrait photography by Walter Rosenblum. And you studied with Minor White at MIT when you were an undergraduate at Harvard. And then you received a Fulbright grant in photography to spend a year in Latin America. As I like to say, you're no slouch. So welcome. I don't think I could do any more to introduce you because, honestly, we're not going to encapsulate your whole life in the 2 minutes, but, really impressive. So excited to have you here.
Thank you so much, Tracy. I think you've done a great job of encapsulating my life. I don't know that there's much more to say, but I will definitely try to say more about anything that might be of interest.
Well, I love, first of all, that you are a person, you've got a beautiful scientific mind and intellectual curiosity, and you've done so much with it. And that's not, I don't need to be being generous to say that it's obviously true, but, I love that you also have this artistic talent and passion that you've followed. So interesting. I was wondering, I'll tell people in a little bit how I first heard about your work, but I'm curious about how you became interested in hypnosis. Because in my experience, I don't know if this has been your experience as well, there are a lot of people in the medical field and the psychotherapy field who really still don't know a lot about it, and they don't realize how effective it can be for so many things. So how did you become interested in hypnosis?
Well, that's actually a very interesting story. Truthfully, if I start at the beginning, it started when I was about 10 years old. And my father was a physician, and he had a room called the den that had all of his medical books in there. And when nobody was around, I used to sneak in there and look at the medical books. And of course, some of them had wonderful naked pictures of people, which I thought was utterly fascinating. And then one day I looked up on the top shelf and I saw there was this very old red volume up there. And for some reason, I climbed up on all the pillows and everything, and I reached up to the top and took it down. And it was a book called Hypnotism, and it had been published in 1904, and the pages were already brown. But somehow it was very fascinating to me. And I sat there and I started reading some things about it. And I was very, somehow drawn to it, even at that age. And then I proceeded, I don't know whether I should say this in the podcast, but this is the story. I went into my older brother's bedroom, my only brother, and I said to him, "I'm going to hypnotize you." And he, of course, said, "No way." And then I turned to him and said, "Well, you can't open your right hand." And he looked at his right hand and he looked frightened for a moment. And then he went screaming to my mother and said, "She hypnotized me. She hypnotized me. I can't open my right hand." And I said, "Well, Peter, of course you can open your right hand." And of course he could. I had no idea what I was doing, and I would never do hypnosis in that way. But you can imagine as a 10-year-old how intriguing that was. And somehow that got filed in my memory somewhere. And then I went on through my life. And when I was about 16, I met a guy who was very involved with yoga. And I knew nothing about yoga, but it was the same kind of feeling. I was very drawn to it somehow. And when he was a counselor, an older counselor at a camp where I was being a junior counselor, and then the summer I came home and I got a big book on yoga with lots of photographs of all the asanas. And I taught myself yoga from that book, and I started practicing yoga. And my parents were not too thrilled because I would go out into Central Park by myself and stand on my head in the park, which they didn't think was such a great thing for a 16-year-old girl to be doing. But nonetheless, I was very determined. And so that kind of got filed in the repository of my brain about this strange interest in states of awareness, of consciousness of some kind. And then I taught yoga later on after college. And I went to South America and did photography, as you mentioned. And then I came back and I thought, well, I really need some kind of day job. I'm not going to earn a living taking documentary photographs. And I sort of thought, the only thing I really want to do is to be a psychologist. And actually, I had resisted that idea for a long time because my mother was a child psychologist. And I had thought, there's no way I'm going to do the same thing as she does. But it turned out that it really was actually a calling for me. So I got myself into graduate school in a PhD program in clinical psychology. And it was a very psychoanalytic program, did my internship in McLean. It was all very wonderful. But somewhere in there, I was still practicing yoga. I was just very aware that there was something missing for me. And somehow I came upon news about a training in clinical hypnosis. And it was nowhere near the Boston area. I think it was in the Midwest or something. And I decided I'm going to go do that. And it was with a guy named Dr. William Kroger. And I went to this intensive hypnosis training program when I was in graduate school. There was no access, no mention about clinical hypnosis. You're quite right. It was just totally not on the screen of awareness. But somehow I went far afield and I took this training. And in that moment of, I don't know, I was 28 years old or something, I thought, this is it. I get it. This is how I want to work. In addition to working in other ways with people, I really understood because he did a lot of work with hypnosis with all kinds of medical conditions. And I thought, wow, this is really calling to me. So that was the moment when the spark really came alive for me in terms of my professional training. And after that, I went again far afield to other training workshops with people in the field of clinical hypnosis that nobody in my training program had ever heard of. Certainly didn't mention it to anybody at McLean because it's so conservative. But I sort of started to pursue my own tutorial in clinical hypnosis. And then when I finished graduate school and hung out a shingle to do private practice, which I'd already known I wanted to do, I was very clear that I was going to integrate that work into my practice because there was such an affinity with all of the yoga work I had done and this hypnosis work, and also the photography, which we could talk a little bit more about later. There was a common thread in the impulse of the state of awareness that was somehow implicit in all of these modalities that was very attractive to me. And so then I found my way learning clinical hypnosis and eventually beginning to practice it, and then did a lot of other professional things that we could talk more about. But that's kind of the origin story, if you will. So I think it's really almost a passionate calling, like some people are called to the priesthood or something. I felt like I was called to different states of awareness, which we could call trance for want of a better word. But as they apply to fine arts, to yoga, to meditative states, and to hypnosis, it's kind of a similar state of awareness. And I was somehow just intrinsically drawn to that, although I had absolutely no exposure externally to that.
I love that. That's such a great story. And it's interesting because I also was drawn to hypnosis at a young age. And it was kind of this incidental kind of discovery, this kind of, I don't think anything's really random necessarily, but that's how it felt at the time. But it really changed the course of my life. This, these hypnosis audio tapes at the time, I was probably a preteen or early in my teens, and I would listen to them as I went to sleep. I mean, they were $5 at a local bookstore, and I couldn't believe that something I couldn't really recall adequately in the morning, alleviated a lot of my anxiety and so forth. So it's always interesting to me when somebody becomes curious about or drawn to something early on and stays with it.
Right.
Yeah. Such a powerful modality. I'm curious how you became interested in hypnosis for healing the body.
Well, I'm not entirely sure. I think it was very informed by my experience with yoga, which of course is a premier modality for self-regulation, if you will, of the body and enhancing health. That's very much part of the philosophy. And as I learned about hypnosis, I learned that hypnosis somehow was able to affect both the mind and the body in ways that made it a very unique kind of treatment tool. So we can alleviate emotional pain with psychotherapy, but we can alleviate emotional pain with hypnosis, but we can also, in medical applications, actually alleviate physical pain, among myriad other applications. And this was so different from any other kind of therapeutic modality that I was aware of. And the people who were in medical school and the people who were in psychology PhD programs didn't have any cross-pollination whatsoever. You were choosing either the mind or the body. And I just, in learning about hypnosis, became so aware that there were things that we could do with hypnosis that would serve both, and that nobody was talking about them and nobody was integrating them into medical care. So in other words, I have a list of, when I do a lot of teaching, I have a page that's called Some Applications of Clinical Hypnosis, and it has categories: psychological, behavioral, psychosomatic, and somatic, and enhanced performance and self-development. And these are sort of large categories. And there are applications of hypnosis in all of these domains, which cannot be said for psychotherapy per se or just medicine. So for example, in psychological applications, we know we can use it for anxiety disorders. You were talking about being a kiddo and listening to programs before bed and then feeling less anxious. We can use it for all kinds of other psychological conditions, even something that's sort of called hypnoanalysis, where we can go inside and consult the inner self, if you will, and access information from deeper levels of awareness and intuition that are not traditionally available to us in regular psychotherapy. And we can work on self-image and body image and low self-esteem and all the garden variety and conflicts, the things that people go to psychotherapy for. We can also work in that domain of behavioral kinds of changes, like even habits like nail biting or thumb sucking, or helping people stick to a medical regimen. Let's say they have diabetes and they have a certain medical regimen and they sort of fall off the wagon. We can help people kind of stick to that with smoking, weight control, stress reduction of all kinds, stuttering, all kinds of things that we can tackle with hypnosis that we can't do with other modalities. And then there's this domain that we could call psychosomatic and somatic. And in this first workshop I took, I remember Dr. William Kroger, talked about a video that existed, an old time movie, if you will, of an opera singer who was delivering her baby by C-section. And for some reason, she couldn't use whatever was they were using for pain moderation at that point in time. And so Kroger, or whoever was doing that at the time, had helped her go into a state of deep hypnotic awareness or trance so that she did not feel pain during what essentially was an incisional procedure of cutting through her belly to get the baby out. And they even invited her to sing an aria while she was going through the C-section, which she did. This impressed me a lot.
I can see why.
I thought, wow, that's just amazing. And so then I found out that we could use hypnosis for even burn control and allergy and asthma and all kinds of pain control. We call analgesia and anesthesia and obstetrics and surgery and dentistry. And nobody in medicine was using hypnotic anesthesia or analgesia. They hadn't really used it since the end of the 1870s when chemical anesthesia was invented. They forgot about the fact that you could actually do that with hypnosis. And nobody in medicine even knew about this. But I was pretty interested in this and all kinds of dermatological things. There are lots of studies of eliminating warts with hypnosis, and gastrointestinal problems. A lot of research on that with nausea and vomiting, even with chemotherapy side effects, and ulcers and colitis and irritable bowel syndrome. Lots of research on the efficacy of that without medication. And hypnosis is a non-pharmacological adjuvant to medical care. I never recommend hypnosis instead of medical care. In other words, if you break your bone, you're going to go see the orthopedist and the radiologist. But adjunctively, what if you could also do something that could help you out in that? And hypnosis is really an adjunctive way of helping out in so many different mind-body conditions that it's not being used in. So the spark had been struck when I heard this thing and when I'd gone to that first workshop. And then, as fate would have it, I started becoming my own patient sort of early on. Maybe I was a little accident prone. I don't know. But I tell the story, and this really kind of was very important, a turning point in my career, my life, actually. One day, it was a holiday weekend, and I went for a run on the ocean beach at Cape Cod National Seashore. I was by myself, except for I had my 2 dogs with me, and I was running barefoot on the beach on this holiday, and I thought, this is just grand. And all of a sudden, I heard and felt that my foot had contacted something which I immediately realized was a 4x4 concrete post that was sort of buried under the sand. And in that moment, I knew I had very badly fractured my toe. And I was away from everything. I was way down on the beach. It was a huge dune to climb up. I was 2 hours from Boston. Everything was closed holiday weekend. I thought, WTF, what am I going to do? And I immediately went into a hypnotic state, and I iced the toe and the foot hypnotically. And then I wrapped it hypnotically with kind of a wrap. And then I even created hypnotically a boot. And I sort of gimped up the hill, all the way up the dune, and got in my car. The dogs somehow were very concerned. They seemed to know that something was wrong. And I got in the car, and there was nowhere on the Cape at that moment to go be seen. So I drove with that foot all the way back to the emergency room in Cambridge, to the local emergency room, Cambridge. And at this point in time, with this kind of injury, it's already swelling. It's already in a lot of pain. It's already beginning to change color. right? Already changing temperature, like being freezing cold, even though I wanted to ice it for the swelling and everything. So I got to the emergency room, and the resident on call said, we don't usually, they x-rayed it, and I had fractured the toe in 3 different places all the way through. It was a nightmare. He said, we don't usually call an orthopedist for toes, but this is so bad. I want you to come back in 5 days and see the head honcho orthopedist. So I was a very busy gal. I was in graduate school. I was working. I had absolutely and I lived in an apartment the bedroom was on the 3rd floor. I had absolutely no time for an injury like that. So I went home and I went into deep hypnosis, sort of like this power napping in my power nap program, and went into a deep state of hypnosis. And I started focusing on healing the bone in the fracture. And I really focused and worked with that for a really long time over the next 5 days. And then I showed up dutifully at the orthopedic appointment and got up on the table. The foot was dangling over the side, and the ortho, the big honcho, comes in the room. He didn't look at me or say hello. He just immediately looked at the x-ray, and my back was to him. He said, "Oh, that's a bad one," and he turned around and he looked at me. And I remember this was like a slow motion movie. He looked at me, he looked down my leg and looked at the foot. And then he looked very puzzled. And the whole consultation consisted of one sentence. He said to me, "I have no idea what you're doing, but whatever you're doing, keep doing it." And so I did. And, that bone fracture healed up in sort of record time. And I sort of started thinking, wow, this is absolutely amazing. And then at some point in time, along the way, I heard that this new outfit at NIH called the Office of Alternative Medicine was going to actually explore what they were calling alternative therapies at that point. And they were putting out for people proposing a pilot grant study to test out alternative therapies. I had never written a grant proposal. Had I known what it entailed to write an NIH grant proposal, I never would have embarked on it. But I felt
the fracture.
I felt so motivated. I felt, wow, what if we could actually document that we could use words, which essentially we're using in hypnosis. We're not using any kind of medical tools. What if we could actually show that we could use words and that could incite the body to heal itself more quickly? What if we could actually find that to be true and demonstrate it in some kind of way that was clearly an experimental kind of documentation of that? So, long story short, I cooked up a project to test the healing of bone fractures using hypnosis. And lo and behold, I got awarded this little pilot grant to do that. And so I created what I call a hypnotic intervention protocol to stimulate the healing of bone fractures, which turned out to be a group of young adults who had slipped in an icy winter that it was in Boston, and they'd fractured their ankles, and they didn't require any surgery. It wasn't displaced or anything. It just was painful, and they required to be in a cast for 6 weeks and all the normal care. And we kind of got a group of them that didn't have any other health variables that were confounding. And I created an intervention protocol that was designed to stimulate the healing of the bone fracture over that period of 6 weeks. And since there wasn't such a thing, I had to create it out of thin air, out of my head. And I had to focus very closely, what I discovered, on what was happening in the moment with that person's fracture. Because what's happening with a fracture 24 hours after it is very different from what's happening a week later, 2 weeks, 3 weeks. So I created this first pass at an interventional, what I call a phase-oriented interventional hypnosis protocol that basically addressed the different stages of healing along the way and tried to encourage the mind-body to accelerate that course. And what we did to measure it, very briefly, and anybody who's interested could read the actual paper of the study, but we actually had a radiologist who was what we call blinded, meaning he didn't know which group. We had a control group of people who didn't have the hypnotic intervention, who had the same fracture. He didn't know who had received the hypnotic intervention, who hadn't. He was just reading the x-rays and comparing everybody to sort of a normal course of healing on X-ray for that particular very common fracture over the course of 6 weeks. He was able to compare everybody's X-rays to that normative kind of course of healing. And lo and behold, it turned out that the people who received the hypnotic intervention showed signs, even at 4 weeks after the fracture, of having bones that were more like 6 weeks healed instead of just 4 weeks healed. So at any rate, this was just a little pilot study. You know, you can't make any big statements out of little pilot studies, but it was enough for me to think, wow, there's really something in this. And everybody knows, or people in the field of hypnosis who don't talk to people in medicine, but people in the field of hypnosis know you can really help people with anxiety. You can really help people be in an MRI machine and be off in Hawaii in their mind. And you can really help them in all kinds of effective ways with pain and everything. But there are not many people who are actually testing out this hypothesis that we could show documented physical healing using just the words in intervention protocol. So that's where I got the bee in my bonnet to start working in that area. And I'll be quiet now for a minute because I've said a lot.
I mean, it was perfect. It was beautifully said, because I think you painted such a great I can tell that you are a skilled hypnotherapist because you painted such a clear picture that I could imagine you jogging on the beach, having this injury, you know, working to heal your own body, and then developing this study and helping other people to heal theirs. Yeah. And actually, that was one of the studies I was going to talk about with you and ask you about. It looks like they had greater functional ability to descend stairs as well, lower use of pain medications, and a trend toward lower self-reported pain even 6 weeks out.
Right.
Yeah. It's amazing, right? Because you're not giving them an injection, you're not giving them a pill, you're helping their minds to do that healing work.
Right. And you know, it's hard to heal something like this kind of non-displaced ankle fracture that is such a standard injury, has such a standard course of healing and what happens in the 6 weeks. So the body has a template of how it's going to heal this particular injury. It's not a wild card. It's not like this is something, oh, I don't know, you might get through this in 8 weeks or you might get through this in 2 weeks. It's a standard course of healing. So if you can actually show that you can influence the body to alter a standard course of healing, in my mind, it's even more exciting and interesting than if you're so it's much more impressive in my mind if you can intervene and get the body to do something that it never in a million years would do, which is to alter a normative course of healing. That to me suggests that you're really perhaps having what we call an effect in experimental design.
I have to take a quick break, but I'll return in a few moments with more on Unpacking Possibility. Stay tuned.
Texting terms at unlock.com/SMS. Privacy policy at unlock.com/privacy-policy. Texting enrolls for recurring automated text marketing messages. Message and data rates may apply. Reply stop to opt out. Terms and conditions apply. For full details, see unlock.com/legal. Actor portrayal.
Lisa, thanks for having me over. Your new kitchen is gorgeous. How'd you find the money to do it?
We worked with this great company, Unlock. They help you unlock the future value of your home to get the cash you need today.
So it's a home equity loan?
No, it's not a loan at all. There's no monthly payments and no interest charges ever. And you can use the money however you want. We were able to redo our kitchen and pay off our credit card debt.
Wow, Jack and I could really use this to finally pay off our old student loan debt. How do I get started?
It's easy. Just go to their website.
Text EQUITY to 865-865 to unlock the value in your home and get up to $500,000 in cash with no monthly payments and no interest ever. Pay off debt, improve your home, add to your retirement fund. It's up to you. Text EQUITY to 865-865. Text the word EQUITY to 865-865. Text EQUITY to 865-865 now.
So then I did another study to follow up on that. And, you know, people said, well, it's just a pilot study. And how do we know that these people didn't heal their bones faster because you were paying attention to them? Well, I thought, well, that would be pretty neat in and of itself if we could get people their bones faster by paying attention to them. But I designed another study in which we had a third group, another course of healing study. And one group didn't get anything other than their normative medical care. And the second group got what we call supportive attention. So they actually had somebody who sat and chatted with them for the same period of time as the third group that had a hypnotic intervention that, once again, I designed. And in this case, it was to accelerate wound healing, tissue healing. And so that we could see whether, was it just that these people were getting attention, or was there actually something going on in the hypnotic intervention that was causing them to accelerate the healing of their, what were surgical sutures. This was a group of women who were undergoing an elective mammoplasty, breast reduction, women who had, very large breasts, who were troubled by it, who had trouble jogging and all kinds of things. And so they had elected to go through this procedure. And the surgeons did exactly the same protocol surgically. But one of the groups every week had a session of this intervention protocol, which was created for the study, encouraging them to have their incisions and their wounds heal more quickly. And so again, we got some very interesting results. There was also a little pilot study, but it turned out that at 1 week and 7 weeks after the surgery, the women who had gotten the hypnotic intervention had surgical wounds that looked more healed, as judged by physicians and nurses who didn't know who was in which group. They looked more healed, significantly so, than the people who just received the supportive attention and the people who just received the surgical care. So I'm not a scientist in terms of doing a lot of research. I'm really a clinician, but I was very excited to go out of my comfort zone to create a couple of studies to sort of really see if perhaps something was going on here.
And just so people who are listening know, I found your research and these two studies specifically, I saw them published. This is over 20 years ago, and it never left my mind how important these two papers were and these studies were. And I reached out to you recently, a little delayed, but better late than never. And I was so excited when you decided to come on the podcast and talk about your work, because it really is so important. And I think what most people don't realize is that most people have some ability to benefit from engaging in hypnosis. The majority of people, I think we all go in and out of hypnotic trance states all the time. And so often they can be negative with the worry, oh, my pain is so bad, I can't take it, or I'm never going to be able to heal this, or how am I going to get through my day? We all put ourselves in those kinds of trances more frequently than we might realize. And your work really shows that thoughtfully focusing on and stepping into the experience of a desired outcome, doing so in the mind, absolutely does have the potential to affect the body in a desired direction. I want to just mention, in the studies you were talking about, you also gave people these audio tapes to practice at home.
Right.
Because a lot of people don't realize that even though you can't see the muscle of your mind, just like with exercising a bodily muscle, practice is really important. But it's easy to do.
Right. I think it's so important. One of the things that I do when I teach, the first thing I do, even if I'm teaching medical professionals, not lay people, is we talk about what hypnosis is and what hypnosis is not. Because one of the things that's gotten in the way of hypnosis being integrated into medical care are the misconceptions and basically the what I call internalized hypnophobia that we all have. When we hear the H word, where we all have a little bit of a fear response to the H word. And so it's really important to help people understand what it is and what it isn't. And because most people come at the word hypnosis with that image of the Svengali guy in the cape, the black cape, with sort of leering over a younger woman and waving a pendulum and saying, "You will sleep, sleep," and, from terrible old movies. And it's clearly malevolent. And we think, oh my God, what is he going to do to her next? And somehow this image, like an earworm, but it gets stuck in the psyche as an image of hypnosis being something about overpowering, controlling, misuse of authority. And that's what most of us, even medical professionals have in our psyches when we hear that word. So it's really important to kind of root that out and talk about some of the myths and what it is and what it isn't. So some of the myths about hypnosis, the most prevalent myths about hypnosis, are things that suggest or people afraid that it's some way of controlling other people. And actually, it's not at all that. It's a way of accessing a kind of self-mastery, if you will, and self-control that can be utilized in a lot of ways. And a practitioner can help you and teach you how to do that. But hypnosis is not caused by the power of the hypnotherapist. Nobody can force you to go into a state of meditation. Nobody can force you to go into a state of hypnotic awareness. It has to be something that your inner self is interested and motivated to do. And there are a lot of other misconceptions, like the idea that you're asleep when you're in trance, which of course comes from the Greek word hypnos for sleep, which was really a misnomer, mislabeling of hypnosis way back in the 1800s, because hypnosis, it turns out, is not a sleep state at all. It's very different from a sleep state. In fact, there's some characteristics of a hypnotic state that are familiar to us as being part of our repertoire of naturally embedded states of awareness that we have in the course of our consciousness as human beings as we go about the course of our day. Because actually, hypnosis is not an exotic kind of voodoo trance state. Unfortunately, we don't have good words for it. And the word trance is also one that's kind of triggering. But it's not some kind of exotic out of body awareness state where you're being controlled. It's really a state of awareness in which you are accessing a kind of focused attention and heightened concentration, heightened awareness. And it's a natural state that we go in and out of all the time. And Tracy, you were talking about something you might call negative hypnosis, but the truth of the matter is that every time we get really focused and absorbed on anything that we're intrigued by, whether that be a movie or a book or playing tennis, sitting by the tennis court and watching the ball go back and forth and hearing that sound, anytime we're really absorbed in something, we're going into our natural hypnotic state. And the neat thing about that state is when we go into it, we're kind of immersed in a way which allows us to access certain capacities which we have natural access to, but which we don't really use or know about because nobody has really taught us to use that state. And in that state, we can alter all kinds of things in our physiology and our actual perceptual sensations in the body and our emotions and our thoughts and behaviors. And we can take in suggestions that we give ourselves, called self-hypnosis, or suggestions if we're working with a therapist that are somehow deemed to be relevant and helpful to us. And this has nothing to do with stage hypnosis, which is sort of a terrible travesty of hypnosis, and it's kind of designed to make fun of people and make people laugh. It has nothing to do with clinical hypnosis, which is really a kind of collaborative enterprise. But people are shocked to realize that hypnosis is not a strange state at all. It's one that we use all the time. We're just not aware that that's what it is. We know it, we know about mindfulness meditation. We know about, quote, flow. We know about the relaxation response. We know about guided visualization. And they really tap us into exactly the same state, but there's something very significantly different about hypnosis from those other modalities, which is that those other modalities mostly function by tapping us into that state, which is the end in and of itself, the end goal, if you will. With hypnosis, we use that state as sort of the matrix, if you will. We immerse ourselves in that state, and then we add in the magic ingredient, which is hypnotic suggestions. And that add in of suggestions that are very specific and very tailored toward an individual in individual therapy are what actually make that modality is so powerful, much more so than just being in a state of meditation or relaxation or whatever. So learning how to create and craft those hypnotic suggestions for oneself or in the context of therapy for somebody else is really quite an added very important feature to this. But the state itself is garden variety. We all go in and out of the state all the time.
So well said and so true. So much misconception out there. As you were talking, you were making me think of something. I said earlier I might share this, but I remember being a fellow, and this was in 2009, and we all got a certain amount of money, a stipend to do continuing education, and I wanted to do my hypnosis training for my certification. And I remember my fellowship was in pain psychology, so it was in a department of anesthesiology, and the chair had to approve anything, any of these stipends. And long story short, I submitted to do my hypnosis training, and I kept having to follow up. I didn't hear back. And then I heard that it was rejected, and I didn't understand why. And my supervisor went and spoke with the chair, and she said, well, we all know that's not a real thing. It's a true story. And then I said, oh, well, to myself, I'm thinking, oh, she just doesn't know about the research. I had several articles that I attached and more clearly explained on my, little paper to submit why I wanted to do this. And I'd been doing guided imagery and self-hypnosis for years before this. It's more that I needed to finish my degree before I could get certified. But she sent it back with a note, kind of like, as I said. And yet it's funny because my supervisor thankfully said, you know what? This is okay. It's an effective approach. We can't pay for you to do the training, unfortunately, but you can still do this with your patients. Just write in the notes that you're doing guided imagery, which is inherently hypnotic anyway. But, there's misconception across fields about what this is. It's not just the average person who might think that it's either negative or not effective. And you did such a great job of explaining what it is and what it isn't.
Right. Right. And, I think it's so sad that we're still at a place. So that's kind of part of my mission these days is as an educator to not just stay within this very brilliant but insular community that we have of clinicians who have done advanced training in hypnosis, but to really step out of that and to try to insinuate myself into different programs. So recently I've actually had the opportunity to offer a course to some psychiatric residents at one of the hospitals here in Boston. And most recently I actually offered a little course to emergency medicine residents. And these are people who've never had this kind of thing in their training whatsoever, but it's kind of my way of being a little bit of a revolutionary and kind of sneaking in there and trying to carry the message across the ramparts because I think I think this is a wave of the future. We're going to, think of the opioid crisis. If we could use what we know to be the hugely successful, impressively documented, scientifically tested field of hypnotic pain management, if we could offer that instead of toxic medications that have side effects and that may be addictive, why the heck wouldn't we do that, right? But we need a change in our mindset to be able to take all of that good stuff and to bring it in. And that's a little bit what I'm focused on these days.
I love that. It's so important. I'm so glad you're doing that. Let me ask you, do you offer, is that something where you're reaching out to various departments and various hospitals, or do you have something on your website where people can reach out to you and bring you in to do some training? How does that work?
That's interesting. Mostly these are things where I might propose it and they say, oh, yes, come and do it. Or I might get an invitation to come and to give a talk. But I know it's going to sound amazingly strange. I don't have a website for my hypnosis practice or even for my hypnosis programs. I have a photography website for my art, and I have a Psychology Today profile for my therapy practice. But I don't have a website for people who might want to contact me to give talks like that. I just haven't done that. So that's a great idea.
Yeah, but after this podcast.
Yeah. Yeah.
Yeah, I mean, it's so needed, and it's so funny because I've thought, how can I be of service in that way as well? And locally there are, I'm sure, plenty of practices and clinics and so forth that you know maybe would be receptive to using even just adjunctively with their patients and seeing how they're going, how they would be responding to using hypnotic analgesia or helping people to relax. I'm thinking even dental practices, because to be honest, I'm one of these people who does not like getting any dental work done. It definitely amps up my anxiety. And so I will listen to hypnotic audios on the way there. I will listen in the waiting room. If somebody lets me listen during something, I will do it. And that's just me knowing how to do it. But how great would it be to have your dentist or your anesthesiologist or someone else helping to relax you before a procedure, or helping you to program your mind for faster healing and less pain?
Right, right. Yes. And I do want to just, that reminds me of something that I think is so important to be aware of too, is that what's a little cockamamie in our culture is not only do medical professionals not know about this, or if they know about it, they think it's bogus and don't accept it, but the lay public, unfortunately, is exposed to more media information about clinical hypnosis than the medical establishment. And in this country, we don't have any regulation of clinical hypnosis. And what that means is we have people who are what we call lay hypnotists, and we have people who are professional clinicians who have degrees to practice in a clinical specialty, and they're licensed, and then they've gone on to get advanced training in clinical hypnosis. But the vast majority of hypnosis practitioners in this country are actually what we call lay hypnotists. And the public has absolutely no way of knowing that and differentiating between those two. And the lay hypnotists are quite successful at putting themselves out there with self-promotions and what used to be the yellow pages. They'd have a big ad that said 1 session, stop smoking guaranteed. And, they did a lot of self-promotion, whereas the professionals did not deem it seemly to be very self-promotional. So that means that the lay public is left at the mercy, if you will, of what we could call the vagaries of lay hypnosis. And why I say that is because a lot of the people who do lay hypnosis are people who have some other kind of day job. Maybe they're realtors, no offense, or whatever else they might do, but they have kind of an interest in it. And they take some kind of course sort of on the weekends in hypnosis. And then they put out a shingle to do hypnosis, but they're not trained clinically. So they don't have the whole foundation of years and years of clinical training to deal with the kinds of issues that in fact can be treated and can emerge spontaneously when somebody is in a course of working in that kind of state of awareness. So that the lay hypnotists, unfortunately, may do some good, but they also have the potential of doing some harm because they may get in waters that are too deep and beyond their ability to know how to be of service to their client, or they probably call them customers for all I know. But the public doesn't know how to find somebody who's qualified and who's a clinician. And that's what educationally wise, I want to just put that out there. A good way to find somebody who's actually trained in this, who's a clinician, is to go to the website of the American Society of Clinical Hypnosis, which is called ASH. And they have, I believe, a tab or section on there for the public to do a search for practitioners who are certified, practitioners who are clinicians who are licensed and have done this advanced training. And you can look it up geographically by state, I believe, and you can find people in your area who you can then contact and talk with about what it is you want to work on. And you can feel pretty safe that those people have had really good training. There's another society called the Society of Clinical and Experimental Hypnosis, and believe they may also have a directory. And there's a place in New England, the New England Society of Clinical Hypnosis, that I believe also has a directory. So for the public to find somebody who actually is a safe practitioner who is also very skilled in this is so, so important.
100%. We are in agreement on that. And what I'll do in the show notes, I'll put the link to ASH and the link to the Society of Clinical and Experimental Hypnosis, and also the New England Society. And I will put a link to your Psychology Today profile as well, so people can contact you if they want to work with you specifically. But Carol,
Massachusetts. A lot. I get contacted by people all over the world all the time. That people don't realize that even with virtual sessions now, as a practitioner with my license, I am only licensed in Massachusetts. I can't work with somebody across any state lines. It's strange but true. So,
yeah, I'm in a similar situation actually, because I'm licensed in New York. So, and I appreciate how ethical you are in saying that. Rather than just being like, yeah, I can work with anybody, which many people do take that approach. Carol, I want to be mindful of your time, but I also want to make sure we mention your art because, again, you are an award-winning fine art photographer. You have beautiful photographs, some of which are available for purchase, I imagine.
Well, yeah, I can be contacted, and sure, we can talk about it. Yeah.
So I will put your website for your art also in the show notes.
Sure.
But is there anything you want to say about that specifically, about the art that you do?
Yeah, because you had kind of made an interesting connection to that, which I appreciated. Most people honestly know me either as a psychologist or an artist, and they're very surprised to find out that I have another hat that I have worn for decades. In fact, I was an artist before I became a psychologist by a long shot. I started doing art in my teens. So the thing about photography is the way I do photography is not, I think, the way most people think of doing photography, which is that they take out their camera and they go on a trip somewhere and they take a lot of pictures and they come back and they show them to their friends or their family or whatever. And that's not at all my approach to it. My approach to it is to take as few images as possible, honestly. And I don't experience it as taking photos. I experience it as making photos. And I actually am not interested in sort of ordinary photos that just document a place or a situation. I'm interested, if you look at my website, it says transcendent images of ordinary reality heightened to a dream, which sounds very much like what? It sounds like a hypnotic state. And in fact, that's the point of intersection. When I make images, I actually mindfully go into that state of awareness before I look for and create and select any kind of image that I choose to make. And so the images are infused with my heightened state of awareness, and they have to somehow have implicit in some deeper layers of experience calling to the viewer. I'm not interested in quick images that somebody's going to look at quickly and go on to the next. I'm interested in images where people are invited to immerse themselves, just as they do in a hypnotic state, to immerse themselves in the experience of the image and to interact. So honestly, it's extremely closely informed by this core interest I've had my whole life in entering into this kind of state.
I love that. Really. And they are so compelling. They really do invite you to spend time with them and feel almost like you kind of step into them a little bit, which in and of itself is hypnotic. Really, really lovely. Is there anything that I did not ask or that we have not discussed that we should have?
I think my takeaway as a teacher is that I really like for people to have more information about this capacity that we have and how absolutely extraordinary it is that it's sort of our wired in state, and to find out more about it and to find ways of learning how to access it and do it for themselves. That's really my wish and my desire, is that we have this self-healing state that's inborn in us. And wouldn't it be wonderful if we actually knew that and we could tap into it? The only other thing that I did in thinking about our meeting today, I pulled up a couple little snippets of audio files, just like 1 or 2 minutes. And if you're interested, I could play a little snippet. So people think hypnosis is going to be very strange, and they might be surprised to hear that hypnotic language is just like ordinary language, but it's sort of like the photographs. It's kind of infused with perhaps a greater sense of mindfulness or depth or meaning. And so I don't know if you want me to play a couple little snippets to just sort of hear that, or
Yeah, we could definitely do that.
well, this is a little tiny minute or so from a program called Rapid Recovery from Injury.
Since you've been injured, now it's time to begin healing yourself. Isn't it nice to know that you have all the resources you need to be in charge of giving your body and mind permission to heal itself quickly and well? Your body has its own natural mechanisms for restoring health. It knows how to heal bones, repair tissue, to recover from illness. Even if you haven't gone to medical school or memorized an anatomy chart, it's comforting to know that your body-mind knows exactly what it needs to do on the cellular level to repair and renew your body now. Since it is your intention to heal yourself, you can transmit these wishes to your body as you find yourself in a more relaxed and focused state. Even the cells of your body will know that you are giving them your blessing as they go about their work of healing.
I'm not really in favor of people just listening to snippets, but I think it's a good illustration. But really, I'm in favor of people taking a program and listening to it from the beginning to the end, because all these programs are sort of training programs, and they really take you into the process of learning how to do this. So these are just like if you were taking a French course. This is not like reading a chapter in French. This is just like hearing a couple of lines so that you hear what the language sounds like. That's what this corresponds to.
I think it was super helpful and
Great.
so interesting. I so appreciate your coming on the show and talking about your work. You know, you do such a great job of explaining hypnosis. This is not easy to do in a way that's understandable both to somebody with more technical knowledge and also to a person with no real other knowledge of hypnosis. And that's an art. There's an art to that. So I really appreciate you doing that. Thank you so much for coming. Honestly, it's been such a pleasure. I really enjoyed hearing from you today.
Oh, thank you so much, Tracy. I appreciate your being savvy about this whole domain and helping with the mission of getting good information about it out there.
Thank you. My pleasure. This has been another episode of Unpacking Possibility. If you enjoyed the episode, and I know you did, please remember to like, share, follow, leave me a comment. Let me know what you want to hear more about. And of course, until next time, as always, be well.